My name is Beth Almeida, and this is my Nursing 409 capstone presentation. One of the most important tasks for a leader is to make sure you accomplish what you set forth in doing. The first step in this process is to develop a plan that you can execute accurately and efficiently. For my leadership capstone project, I identified a need for education at my workplace. My current need is to educate staff and lead them on the best practices when dealing with the Zika virus. At the current time, we do not have a position within the organization that is responsible for maintaining staff's level of knowledge on emerging potential health crises. Even though there's not a wide body of knowledge known at present time of the Zika virus, there are many associated risks with it, and the more information that I could provide to my fellow coworkers, the better care to the community would occur. The leadership qualities I focused on was to be concerned with the common good, impacting my other nurses and staff members to understand the importance of acting locally when dealing with a global issue was a priority. I was able to give them confidence through this presentation with their knowledge of the Zika virus so that they too can be concerned with the greater good and translate it for the community. The other aspect was being able to believe in other people. I enabled my colleagues that knowledge is empowerment. I gave them confidence by education and teaching them how they can communicate with our patients to help them understand the seriousness of the Zika virus. I had to especially focus on our non-clinical staff that answers the phones or checks patients in because they are the first person that patients usually ask questions of. The action steps that I utilized was to use my influence with the staff as they know me as a preceptor and educator on other nursing projects in the past. I provided credible information utilizing the Centers for Disease Control, along with peer-reviewed research and Harvard School of Public Health. I was able to engage staff in open communication through an email in-service presentation with evaluation tools of their previous knowledge of Zika, and then again after the presentation, and then follow up and evaluate on what they utilized for the following 2 weeks after the presentation. I also provided the staff with hard copy information about microcephaly and use of bug spray and mosquito repellent to help prevent the transmission of Zika, and also scripted reference cards that were actually already provided by the CDC on how to deal with talking to patients about these topics. The initial plan was for an in-service presentation during a staff meeting, but unfortunately, due to an unplanned visit from our company president on the day I was supposed to give my presentation and an unexpected OSHA visit, we had to change it to an email in-service with an in-person follow-up on the different areas of the clinical and non-clinical staff. I believe that the presentation was actually more effective this way because staff were able to review the PowerPoint at their own pace, and I was able to follow up with staff directly on my own time to see if they had any further questions or needed some more information on the topic. And because of this, I was actually asked by 2 different staff members if they could print it up and share it with their teenagers at home. So that was a nice surprise outcome. As far as the presentation itself, it was this PowerPoint presentation. The PowerPoint presentation, the different forms of transmission between what the species of the mosquito was that transmitted it, how it's transmitted through sexual activity. I then went into the signs and where they may see after they are exposed to it. These include the headache, fever, painful or red eyes, joint pain, itching rash, and muscle pain. The methods of diagnosis, and I included an electron micrograph of the actual Zika virus for them to see also. Treatment plans were reviewed, which were mostly followed by any other virus, treating the symptoms. There's no vaccine for it right now, and always staying current on patient medications and their signs and symptoms. The Zika virus, especially reviewing the microcephaly risk that pregnant women have if they contract the Zika virus. This was actually one of my most well-received slides. Many of the staff did not know where Zika has been reported on, and I reviewed not only the world, but States and where it's been reported in the United States. And like I said, these two slides were most commented on because the staff just did not have an idea of the extent of it. I also about it this was presented before the April school vacations, the upcoming Olympics, and on sexual transmission, which most of all of the non-clinical staff did not know that the Zika could be transmitted through sex. So I think that was a big accomplishment. The prevention, the limiting travel, the insect repellent, having safe sex with anyone who has traveled abroad was all reviewed here with locally on the Bristol County Mosquito Control, on the services they offer, and for family planning in my local area within Taunton on where they can receive more information on safe sex practices. Give a brief synapse on what the laboratory procedure is, which only one of the lab techs knew what the procedure was, simply because she also moonlights at Brigham and Women's. But the other the other phlebotomists found this very helpful as a starting point. I then went into what my evaluation questions were, and this was given to them as a handout on before and after the presentation. And then also on the 2-week follow-up questions that I wanted them to evaluate on how much information they shared with their patients. So like I said, the most outstanding information that was given was that a lot of the staff did not know that it was sexually transmitted. And many of them, nurses included, did not know about the Bristol County spraying initiative that they just have to call to have their neighborhood sprayed to reduce the risk of mosquitoes and the transmission of diseases. So in all, this was sent out to 35 people, including secretaries, LPNs, RNs, phlebotomists, and even a few physicians. And assessing it, 42 patients asked staff about the Zika in the 2-week time frame given. And none of the patients were aware of the mosquito spraying also. The staff in general stated that they felt better prepared to communicate with the patients about Zika and give them information about resources within the community. And even one physician, only one physician, stated that they knew about global issues affecting locally, and that is a physician who also has a master's of public health. So I was not surprised about that. But many of the staff did not realize that they had to be concerned about this issue. And the staff also came back with information to me that they felt that they were much more at ease communicating with patients for their questions and how to give them more information. Some of the handout was what is microcephaly, especially for our non-clinical staff, just so they can have a brief idea of what microcephaly is and the effects of it. Gave out mosquito bite prevention. These forms were all offered on the CDC website, and this one was placed in all of our waiting areas. This was one of the script cards for questions that patients might have that would help our staff communicate with the patients. And then my project had the outcomes of compiling accurate information on the Zika virus through this PowerPoint presentation, offering the script card, and giving resources to the nurses that they can utilize to continue education with. I was able to facilitate follow-up communication on a daily basis. I would walk around at the end of the day and take me about 15 minutes to just touch base if anyone had any questions or needed more information. And I did have staff come up to me throughout the day, both in person and through email, with follow-up questions. And one of the unexpected outcomes of this presentation was the initial change in plan from an in-person service to an email-in service, which actually worked out very well, I feel. This showed that I was approachable as a leader and was able to share information for the greater good. I did find that just over half of the patients that were concerned about partners traveling to these affected areas, which surprised me. I thought they'd be more concerned about themselves and not as aware of their partners traveling. And I did have 3 staff members state to me that they wished that they could receive more information like this on different topics. They stated that they thought patients would be appreciative of our staff being aware of global issues and how we could affect their care. One of the weaknesses of my project is that I should have been more specific in my evaluation questions, as in what age were the patients that were concerned about the Zika, if they were pregnant or planning on becoming pregnant, or if they did have any education about Zika, or if they had just heard it in the news and wanted more information. I feel that I could have had a better understanding of my population needs if I had been more specific in my population questions. As far as a leadership weakness, I think it was that every leader faces when having to devote time to a project, and that is time. It always seemed that once I was mid-conversation with a staff member that had further questions, something else would come up that I was needed more urgently to attend to. And finding that time, I believe, is the hardest part of any leadership project. I think finding ways to handle multitasking would be in my best interest moving forward, and developing my leadership skills and finding more effective ways with my time management. Thank you, and good luck to everybody.